Health Information Professions Week. Accurate Information Quality Care, April 3 through 9, 2016. A quick note as we get started. This presentation is based upon content presented on each slide and information provided in the notes section below for the purpose of maintaining ADA compliance. 2016 Celebration of Health Information Professions Week, the Patient Revenue Cycle. Welcome to the session. My name is Jennifer Talbot and I am the Health Information Technology Program Director here at Kirtland Community College. Topics. What is a revenue cycle? Stages of a revenue cycle. What non-revenue cycle person needs to know. The Health Information Professional's Role Conclusion. Welcome to the session The Sky is the Limit, a 2016 celebration of HIM careers. Health information management professionals are often seen as a person who answers phones, files medical records, or sends medical bills to patients. While some of us do these tasks, there is so much more involved with this profession than meets the eye. For today's topic, I am going to talk about the revenue cycle. The revenue starts and stops with the patient. Without the patient, our revenue cycle would be non-existent. Did you know there are many important stages to a revenue cycle, and that stage starts when a patient picks up the phone and calls a provider's office for an appointment? A healthy practice or hospital revenue cycle flows smoothly, with many opportunities for health information professionals to provide important knowledge to keep the cycle on track. Join me as we travel through the life of a revenue cycle. Learn what health information professionals do to ensure compliance, accuracy, and integrity are involved at every step of the way of a patient's revenue cycle. Learn what we do to make sure we do the right thing. The definition of a revenue cycle. The revenue cycle refers to the series of activities that connect the services rendered by a healthcare provider with the methods by which the provider receives compensation for those services. The revenue cycle starts with the patient visiting the provider's office for a medical service. The provider examines the patient, assigns a diagnosis, and treats patient if warranted. When patient leaves the office, they either pay the bill or authorize the provider's office to submit the bill to the patient's insurance. Basic stages of revenue cycle. The revenue cycle starts when a patient schedules an appointment with their provider. The registration specialist will likely open up a new account for the patient's upcoming visit. That account number will have the patient's demographic information, as well as insurance information. If the insurance needs prior authorization before the patient's visit, this will also take place before the actual appointment date. When the patient presents for their appointment, they check in. Revenue cycle starts with patient. The revenue cycle starts when a patient makes an appointment or presents for medical treatment. What do you think of when you hear revenue cycle mentioned? If you think of the patient, you're spot on. Each patient visit holds their own individual revenue cycle process. Depending on the setting, it can start when a patient makes an appointment or presents for treatment. It doesn't matter what the setting is. That's a lot of revenue cycles. One patient revenue cycle is one of many revenue cycles active in a system at one given time. Patient calls for an appointment. If a patient calls to schedule an appointment, scheduler will ask the following. 1. Has the patient been seen before? 2. Chief complaint. 3. Name, date of birth, contact information. 4. What is patient's insurance? 5. When does patient want to be seen? The But the scheduling specialist may also ask if the patient is being referred by another provider. The reason for so many questions? It is a scheduler's responsibility to make sure all of the information collected at the beginning of the patient's visit is correct, and if it is necessary to get authorization from the insurance prior to visit. Also important to note is the copay. More practices are stating the amount owed prior to the actual visit so the patient can be prepared to pay for any copays or additional charges prior to being seen. With this information, the scheduling specialist will pre-register the patient. Pre-registration includes entering the patient into the system. A word about numbers. Medical record number is a number assigned to patient by that specific practice. The same number will follow the patient throughout all visits with that practice. Encounter number, sometimes referred to as a visit number. This number is specific to the patient's individual visit. It is only used once. All services for that specific visit fall under the encounter number. Patient presents for appointment. When a patient presents for an appointment with their healthcare provider, the registration specialist will ask them questions to start the revenue cycle process. They will ask if the patient was seen at that site before to determine if the patient is new versus established. I will tell you why that is important later. If the patient is new, demographic information, insurance information, and consent for medical treatment and HIPAA statement of understanding will be explained to the patient and signed. If the patient is established, the registration specialist will verify all information within the system is correct prior to proceeding with the copying of insurance cards and updating any necessary consent for treatment forms. While the patient is waiting, the registration specialist verifies and updates all patient information in computer's registration system. Patient is ready to be seen. An item of critical importance during the registration process is to confirm the patient has the correct medical record number. That is one patient, one medical record number. This is important for correct billing methods, but more importantly for patient safety, privacy, and confidentiality. Patient is seen by provider office. Provider meets with the patient and performs pertinent exams, tests. Provider or their scribe records the information in the patient's medical record. The patient is brought back to the exam room, usually by a medical assistant, who checks the patient's weight, height, takes vitals, and records patient's chief complaint in the electronic medical record or on paper. The provider sees the patient. She or he asks questions and performs a physician exam. Patient is seen by provider ER. Provider meets with the patient and performs pertinent exam. Provider or their scribe records the information in the patient's medical record. Provider orders labs and other ancillary exams as needed to help determine the diagnosis. When a patient is seen in the emergency room, the process may vary depending on the patient's level of consciousness. The patient is examined by the provider. The scribe records the dialogue between the provider and patient as well as notes any ancillary exams. Behind the scenes. After patient leaves, the provider reviews the medical record and performs any pertinent dictations, indicates the patient's diagnosis, necessary follow-up, etc. This is an important process in the patient's revenue cycle. It is up to the provider to ensure the patient's visit is noted completely in the medical record for that encounter. The diagnosis and any procedures indicated will provide medical necessity. That is, they need to support each other in order to get appropriate reimbursement from the patient's insurance. For example, if a provider treats a patient for a migraine and in the same visit orders an x-ray of the patient's knee, The X-ray would not be paid due to lack of medical necessity. The diagnosis does not indicate why the X-ray of the knee was ordered on that same visit. Without that important information, payment can be denied or delayed. Chart reviewed by coder. Specially trained medical coder reviews chart and assigns appropriate codes to chart based on documentation that provider noted in chart. Critical step in the revenue cycle. You may be wondering, what is a coder? A coder is a trained medical professional who reviews the patient documentation the provider creates in a patient's medical record. From that documentation, the coder locates a code that best describes that patient's encounter. They will assign a standardized ICD-10-CM diagnostic code and or ICD-10 PCS codes and or CPT codes that are found in current year code books or computer programs called encoders. Codes are assigned based upon knowledge of strict coding guidelines mandated by government agencies such as Centers for Medicare and Medicaid Services, American Hospital Association, and American Medical Association. A coder must have detailed knowledge and advanced understanding of anatomy and pathophysiology as well as pharmacology. Some coders have learned on the job, while others have gone to college or special coding programs and learned through rigorous teaching methods. After a coder is through coding the patient's visit, the visit will be electronically submitted to the insurance payer for reimbursement. Coding data are also collected by some organizations in the United States to aid in research and development. With the United States moving to ICD-10 coding system, certain data can be shared globally due to being up to date with a coding system the rest of the world uses. Claims submitted to insurance. Once a coder reviews the encounter and assigns the appropriate diagnosis and or procedure codes, the encounter is sent electronically to the payer. Payment is expected within a specific time frame from the payer. Insurance sends payment. Accounts receivable processes payment. Patient accounts department, i.e. billing, indicates payment was received in the patient encounter. If an outstanding balance remains, patient accounts will send bill to patient. Once the payment is received from the insurance payer, patient accounts notes that payment in the patient's encounter. If there is any monies owed, patient accounts will generate a bill to the patient. The patient encounter remains open until the encounter is paid in full and a zero balance. The health information professional's role. The HIP is a specially trained healthcare worker seen in a variety of non-clinical roles. The HIP's work is closely tied to the revenue cycle process from beginning to end. The HIP partners with other departments in order to ensure a patient experiences both efficient and effective documentation processes before, during, and after their encounter. The health information professional integrates seamlessly into many processes within healthcare. The HIP ensures the correct patient and correct medical record number is used. Demographics are up to date. Medical record documentation is detailed enough to note the reason for encounter as well as any treatments and supports medical necessity for reimbursement. HIP works with providers to ensure documentation practices are compliant and efficient. Specialized health information professionals, called coders, review the documentation after the patient visit and assigns any ICD-10-CM diagnostic codes as well as any procedure codes. Coders make certain the codes and any associated procedures meet medical necessity. If they don't, the provider is sent a query for clarification. HIP also works on the back end in patient accounting and billing. The revenue cycle extends beyond the patient. In fact, the smooth operation of a revenue cycle ensures practices and facilities remain sustainable in the ever-changing healthcare environment. Conclusion. The patient revenue cycle is comprised of a complex series of steps. Like well-oiled cogs in a machine, each step must operate efficiently within itself in order to ensure the entire revenue cycle is operational and sustainable. The health information professional provides important information at each step, thus making the HIP a valuable asset in today's ever-changing healthcare system. Thank you for joining me today for this presentation to show our appreciation for healthcare professionals everywhere and to support Health Information Professionals Week.